Your child has a fever. Lots of illnesses that cause fevers are contagious, so it's important to take some simple steps to keep others from getting sick. Keep your ill child separated from others in and outside of your home. Cover their mouth during coughs and sneezes. Wash hands regularly and avoid sharing things like bottles, cups, straws, and toys. Your care team will talk with you about what caused the fever, but we wanted to talk about how to manage it at home. Normally, the body's temperature is around 98.6 degrees Fahrenheit. This temperature can vary with activity or if infants and children are overdressed. Any temperature above 100.4 degrees Fahrenheit is considered a fever. Fever is one of the body's natural and normal ways for fighting infections such as viruses. High fevers, sometimes up to 104 degrees Fahrenheit, fevers that don't seem to go away completely with medicine or come back shortly after taking medicine, don't necessarily mean your child is sicker. To determine if your child has a fever, it is best to use a thermometer. There are several ways to take a temperature. A rectal temperature, a temperature taken in your child's bottom, is most accurate. Unless instructed differently by your doctor, children 3 months and younger should always have their temperature taken rectally. This is preferred in older children as well, but you can consider an ear or armpit temperature in children older than 3 months. For children older than 4 or 5 years, you can also check their temperature by mouth using an oral thermometer. How to take a rectal temperature. Choose a quiet place so that the baby won't be distracted or move around too much. Put a lubricant jelly or petroleum jelly on the tip of the thermometer. This will help you to insert it easily. You can place your baby on their back or on their belly. Place your baby on their back with their legs bent towards their chest. Place your hand on the back of the thighs or holding their feet as if you were changing a diaper. Or place your baby on their belly, on your lap, or on a flat padded surface such as a bed. Spread the baby's buttocks apart with one hand. Gently insert the tip end of the rectal thermometer about 1/2 to 1 inch into the rectum. Don't force it. Hold the thermometer in place with 2 fingers close to the rectum, not near the end of the thermometer. Leave the thermometer in place for the required amount of time. Some digital thermometers give a series of short beeps when the reading is done, or you can time yourself with a watch or clock. When finished, clean the thermometer with cool, soapy water and rinse it off before putting it away. After a thermometer has been used to take a rectal temperature, do not use it to take an oral temperature. How to take an ear temperature. Check that the ear probe is clean. If it is dirty, wipe it gently with a clean cloth. Do not put the thermometer in water. To keep the probe clean, use a disposable probe cover. Use a new probe cover each time you take an ear temperature. Turn the thermometer on and pull the earlobe back. This will help place the probe in the ear canal. Center the probe tip in the ear and push gently inward toward the eardrum. Press the on button to display the temperature reading. When finished, throw away the used probe cover. How to take an armpit or axillary temperature. Place the thermometer under the arm with the tip in the center of your child's armpit. Press your child's arm against his or her body. Leave the thermometer there for as long as the instructions say, then read it. When finished, clean the thermometer with cool, soapy water. Rinse it off before you put it away. How to take a temperature by mouth. Place the thermometer under the tongue, just to one side of the center. Have your child close his or her lips tightly around it. Leave the thermometer in place for the required amount of time and then read it. When finished, clean the thermometer with cool, soapy water and rinse it off before you put it away. If your baby was born premature or is less than 3 months of age, you should always call your child's doctor for instructions for fevers of 100.4 degrees Fahrenheit or higher taken rectally. In older children, the reason to treat fevers is to keep them as comfortable as possible rather than getting their temperature back to normal. If your child's temperature is 100.4 degrees or higher, you may use fever medicines such as acetaminophen. If they are 6 months of age or older, you can also use ibuprofen to treat their fever. You should not use ibuprofen in children less than 6 months of age. You can safely give both at the same time or consider alternating between the two every 3 hours. Give acetaminophen, wait 3 hours, give ibuprofen, wait 3 hours, give acetaminophen, etc. Carefully read the directions on the label of the fever medicine you choose so that you know how much to give your child, and be sure to measure the dose correctly. If you are unsure, call your doctor or talk to your pharmacist. Only use the dropper, measuring spoon, or cup that comes with the fever medicine. Do not use household spoons to measure. Do not use adult versions of medicine for children. Do not give aspirin to your child, as it is linked with a rare disorder called Reye syndrome, which can be fatal. All medicines can be poisonous if too much is taken. Be sure to keep all medicines out of the reach of children. Keep your child comfortable at home. Do not overdress him or her, and do not give cool baths or cool sponge baths, as this can be uncomfortable for a child with a fever. If your child is asleep, you do not need to wake them up to give them medication or to take their temperature. Sleep is more important. Give your child more to drink when he or she has a fever. This will help to prevent dehydration. In older children, notify your doctor for a fever that lasts longer than 2 days. If your child develops new specific symptoms since your visit, such as a sore throat, ear pain, or urinary pain, your doctor should also be notified. If you have any other concerns, your doctor can help direct your child's care. You should seek care if you're not comfortable with how your child is acting, if he or she does not respond to you, has trouble waking up, or is limp. If your child has a stiff neck that he or she cannot move, or a severe headache, you should also return for a repeat assessment. If your child refuses to drink or is too sick to drink enough, is not urinating regularly, has severe belly pain, difficulty breathing, is crying or whimpering and cannot be consoled, or has purple, bruise-like spots on their skin, he or she may also need to be reevaluated. If you need help deciding whether your child needs to go to the hospital, you can have a video chat with a pediatric provider 24 hours a day, 7 days a week.